All right, everyone. Thank you so much for joining tonight. My name is Dessa. I'm the Executive Director of Detroit Disability Power, and it's really good to see both some familiar faces and some new folks tonight. It's um, it's an interesting time, and we are very happy to be doing this teach-in. This you're going to get a lot of information, a lot of good food for thought, and also a call to action tonight. So we have some interactive parts, and also we're going to be sharing quite a bit of information. If you want some of this information later and can't keep up with note taking or however you do it, that's cool. Be in touch with us, and we'll make sure you get what you need. Also, we're going to be posting a lot of links to important research and news articles in the chat tonight. So before we go any further, I want our DDP team to quickly introduce ourselves. Our chat moderator tonight is Rami. Rami, can you say hello?
This is Rami. Hi, everyone. I am the community organizer for DDP. I'm from Detroit, and as Dessa said, I will be the chat moderator today.
This is Dessa. Great. Thank you so much, Rami. And one of our main presenters tonight is Jeffrey.
Hi, good afternoon, everyone. This is Jeffrey. I'm the Policy Director for Detroit Disability Power, and I'll be presenting after Dessa today.
This is Dessa. Thank you so much. And, DDP is a team that pulled this off together, not just the three of us. There's a lot of other people who made this happen. So thank you to everyone who was a part of that. Before we go any further, I just want to note Matthew Butler, who hopefully you can see is our ASL interpreter tonight. If you need to pin the screen, you can click on the top right corner of his little square. There's 3 dots, and then you can go down to pin so that his image stays present for you. A little while later, we're also going to be sharing a screen, heads up. And then also at the top left of this larger Zoom screen, you will see that we have automated live captions through Otter AI. Click on that if you'd like to see captions. Before I continue, does anybody have any additional access needs at this moment? If so, you can unmute and tell me, or you can put it in the chat. Okay, fantastic. I think we're good. And that is where we want to be. So like I said, my name is Dessa, and I started Detroit Disability Power about 2.5 years ago because I saw a really serious gap in the political work and the social justice work happening in Detroit for people with disabilities. There's all this incredible civil rights work happening for different marginalized communities, and I didn't see the same level of civic engagement in the disability community. And so at Detroit Disability Power, we organize people with disabilities and our allies. We work in coalition on various social justice issues that impact people with disabilities, maybe not exclusively, but of course, all issues impact disabled people because we are everywhere and we are part of every community. And we also do a lot of anti-ableism trainings for organizations, businesses, city governments, whoever wants to learn more about how to be more inclusive and accessible to people with a variety of disabilities. And we also do consulting work to help those businesses in a more kind of prescriptive, deeper dive way. So we do a lot of things. Of course, like many organizations over the last year, we have been super focused on COVID. And so that is why you're here tonight. Our organizing has certainly been focused on that. And I want to tell you a little bit about what we've been up to before Jeffrey tells us what's happening with the vaccine in Michigan and what really should be happening with the vaccine here in Michigan. So time is weird now, but I'm going to invite you to think back 11 months to when COVID first hit the US. It became clear very quickly to most of us that existing inequities would not only be amplified by the pandemic, but would probably be more deadly than they even normally are. And as people with disabilities, we know that these inequities hurt and kill our community members on a good day, right? And so while there was a lot of work to do before COVID, there is definitely a lot of work to do now. And if you think back to the news 11 months ago, the dominant narrative was pretty pretty disturbing. It was basically like, calm down, everyone, don't worry. It's just the sick people. It's just the old people that are going to die from this thing. Like, just calm down, everyone. I know how that made me feel as a person who's been disabled my whole life. Does anybody want to share how that made them feel? Did anybody, you can put it in the chat, you can unmute yourself, but when that narrative was kind of like coming out of the airwaves, did you have a reaction to it? Yeah, well, here was my reaction. My reaction was like, wait, hold on a minute. We are the sick people. We are the old people, right? Like, we're not expendable. You don't say that we're this necessary, inevitable collateral damage of systems failure, right? Yeah, very concerned, very sad. I'll also say I was pissed. I was so angry at how quickly it was evident that we were just not going to be a priority. And, since then, speaking of, it's just going to be the sick people and old people that die, to put it bluntly, since then, we have seen that residents in congregate settings like nursing homes are dying at exorbitant rates. We know that 1% of Americans live in nursing homes and 36% of deaths are in nursing homes. That is an enormous disparity that's completely unacceptable. So obviously, many of us with disabilities and chronic illness were on high alert immediately when this happened. As I said, even in good times, we tend to fall through the cracks. So, like, what would a global pandemic mean for us? What would this pandemic mean for our ability to access healthcare that we normally and typically rely on? What about those of us in group homes or with personal care attendants? How are we supposed to socially distance from others? If we do get sick, our doctor is going to prioritize our care. Will assumptions about our quality of life be used to deny us treatment? When the economy starts to recover, will there be a plan to help us get jobs? And now that there's a vaccine, how do we adequately ensure that we're prioritized in the vaccine distribution plan? These are just a handful of the super critical life and death questions that I know were running through my mind and all the other disabled people I know's mind too. And so here at DDP, throughout the pandemic, we have been raising these important and legitimate questions. We've been trying to get it in the paper. We've been trying to get it in the face of elected officials and other decision makers. Disabled activists across the country have been organizing, writing op-eds, pleading anyone who would possibly listen for equitable treatment in this catastrophe. Speaking for DDP, I can tell you it has been a hard 11 months. It has been a fighting 11 months just to get recognition as a vulnerable group in this moment and to get protection from the virus and from inadequate emergency response from our government. So real quickly, I want to run through a few of the things that we've been up to address these disparities that we know disabled Michiganders are facing. We immediately compiled and shared COVID-19 resources at the local and state level, particularly ones that were for people with various disabilities. We sent a letter to the Michigan congressional delegation with policy requests to prohibit disability discrimination in rationed, scarce medical resources, to prioritize and expand home and community-based services and supports during COVID, to require certified deaf interpreters for all government briefings, and other ideas. We successfully advocated to get the governor's stay-at-home order translated into ASL. Can you believe that that took advocacy? That's ridiculous. We put out a press release when the Henry Ford Health System memo was leaked and showed that they were discriminating against patients with disabilities, and this was picked up by Bridge Magazine. We organized over 50 organizations to sign on to a letter to Governor Whitmer and the DHHS director, asking them to make a public statement about non-discrimination in healthcare delivery. We advised the Detroit Office of Mobility about the accessibility of the drive-through testing sites in Detroit. We hosted 2 awesome self-care events. We did a group showing of the movie Crip Camp. If you haven't seen it on Netflix, it is awesome. And we also hosted a event called Self-Care for Social Justice Activists, how to take care of ourselves in this incredibly stressful time. We sent a letter to the governor, the lieutenant governor, the Department of Health and Human Services, and the Michigan Department of Civil Rights, requesting data collection about the disability status of COVID patients, about prioritizing non-discrimination through an executive order, and ensuring that they had an inclusive response. I'm happy to say that soon after, the governor did sign an executive order ensuring non-discrimination in healthcare delivery and rationing, and many groups were advocating for that to happen, and it culminated in a win. I want to share a couple more things that we did before I move on, because this really, I think, shows you like how long we've been at some of these things and the various tactics that we have taken over the last few months. So we also spoke at a Detroit City Council budget hearing about the need for the city to have an Office of Disability Affairs that specifically meets the needs of our community during a crisis. We spoke on countless panels, signed on to countless letters, and had countless conversations with decision makers. We worked with Senator Chang and Representative Hoadley at the state level, who then introduced legislation to ensure that the non-discrimination executive order signed by the governor automatically goes into effect in any public health emergency. And we helped to write and compile best practices for accessibility at the 22 Michigan testing sites with the Director of Minority Health at MDHHS. So that's just a small taste of what we've been up to over here. We're tired, but like this is what we do. So it's to be honest, it's been a real mixed bag of some wins and some losses. But that is not a deterrent. This was all done to protect our community from COVID and from discrimination, right? This was all about showing elected officials that we're not only here, but we're paying attention and we matter. All of this has been an opportunity to build our collective power. And we're so glad that many of you have been on this journey with us for a while, and really excited about those of you who are new tonight. It's really has to be a collective effort. So it's been, if you've been paying attention to the news, you have seen hopefully the incredible work that the state of Michigan has done to close the gap or close the disparity for African Americans in our state who were initially contracting and dying from COVID at alarming rates compared to white Michiganders. The gap was huge. It was really important that the state stepped in and had particular interventions for Black communities. And that data collected about COVID patients' race was crucial to finding interventions that closed that disparity, right? So if they didn't know the patient's race, they didn't know that there was a disparity, and then they couldn't solve the disparity, right? So DDP has been a part of this Michigan Coronavirus Racial Disparities Task Force and has been helping to bring a disability perspective to that work. Now, the disability community, which includes 106,000 disabled African Americans just in the city of Detroit, is still trying to get the state to collect the disability status of COVID patients. So currently we're in this situation where we go to decision makers and we say, there is a disparity for people with disabilities. We are contracting and dying of COVID more than other people. And they're saying, show us the data. And we're saying, but you're not collecting the data. We've been asking you to collect this data for 11 months and you're not doing it, right? So Jeffrey's going to share some data with you in a little while. It's not from Michigan. It's not comprehensive. And some of it is quite new. So here we are 11 months later, and we couldn't tell you how many people with disabilities in Michigan have gotten or died from COVID. So as I said at the outset of this conversation, existing inequalities have been amplified by COVID and by our government's response to COVID. It could not be more important that we're attacking the problem and creating solutions in an intersectional way. So for example, if we know that African Americans are 1.5 times more likely to die from COVID than white people, and we know that disabled people are at increased risk of COVID also, how do we craft a plan to ensure safety for Black disabled people? Right? Both identities matter, both play into the situation and the danger, and both must be prioritized to do the most good for people at that intersection. So we definitely have our work cut out for us. I know that I have said a lot. I really wanted to cue up that context though, so that we're all kind of starting on the same page as Jeffrey starts talking about the vaccine effort that we're currently undertaking and need your help on. So I'm going to hand it over to Jeffrey, who's going to share his screen. So there'll be a quick adjustment. And all right, Jeffrey, thank you so much.
Okay, this is Jeffrey. Right now you're looking at a blank desktop. Let's change that. There we go. Cool. So you should be seeing a PowerPoint. I'm going to make it a full screen. And I'm going to move some of these faces away if I can.
Jeffrey,
Yes, Marguerite.
please make it smaller. I need to see the closed caption.
Is this okay, or you want me to make it bigger?
No, smaller. Because it's taking up the whole screen.
Okay.
Because the closed caption, I won't be able to see closed caption.
Okay.
Thank you.
Yes. So let me make sure I'm doing this right. I need this to be bigger, but I don't want it to be too big.
Yes. Yes.
Is this okay right now with closed captioning?
Let me see. Hold on.
Maybe I should talk so you can see the captions go up.
Yes.
Good?
Yes. Thank
Okay.
you.
You're welcome. Thank you for letting me know. I appreciate it, Marguerite. Okay, my name is Jeffrey.
You're welcome.
My name is Jeffrey Nolish. I'm the Policy Director for Detroit Disability Power, as I mentioned earlier. My pronouns are he, him, his. I have brown skin. I identify as Latinx, and I have brown eyes, black hair, and I'm wearing a plaid button-down shirt today. And my presentation is very brief, but it is called COVID-19 Vaccination Teach-In. The subheading is Science, Data, States, and Priorities regarding people with disabilities. So I'm going to get started. I mentioned science because last March 2020, Dessa and I and others came across a report from the World Health Organization that flagged the potential for greater risk from COVID-19 to our disability communities. And this was due to a number of factors. These factors were, or continue to be, are barriers to implementing basic hygiene measures, such as hand washing, For example, difficulty accessing a hand basin, sinks or water pumps might be physically inaccessible, or a person may have physical difficulty rubbing their hands together thoroughly. In addition to this, some folks have a difficulty enacting social distancing because of additional support needs or because they live in institutions. Another factor is the need to touch things at times to obtain information from the environment or for physical support. There are also barriers to accessing public health information. This could be language access, such as ASL access. It also could be something not accessible on a website. In addition to this, another factor is pre-existing health conditions underlying someone's disability, barriers to accessing healthcare, and serious disruptions to someone's service. The next slides are going to be on data. And what I want to say here, leading into these slides, is we all had some concern last year early on, and now we fast forward to what we've learned since then. So this is from a report called Risk Factors for COVID-19 Mortality Among Privately Insured Patients. What this study found was that people with intellectual and developmental disabilities are 3 times more likely to die from COVID-19 than the rest of the population. We've said this statistic before. You've read it likely or heard about it in news stories or in various articles. But if you drill down into the data itself or the study itself, you'll see that it specifically says regarding developmental disabilities across all groups, COVID-19 patients with developmental disorders and disabilities, for example, speech and language, developmental disabilities of scholastic skills, central auditory processing, these had the highest odds of dying from COVID-19, these folks with these disabilities. And in addition to that, people with intellectual disabilities and related conditions across all groups, COVID-19 patients with intellectual disabilities and these related conditions, such as Down syndrome and others, had the 3rd highest risk of COVID-19 death. And among COVID-19 patients under the age of 70, intellectual disabilities and related conditions still had the 3rd highest risk. And I want you to put a pin in that, or to write that down, or to remember this, because many, many plans that are prioritizing people are based upon age. And here, this report and study says, listen, if you're under 70 and you have these intellectual or developmental disabilities, you are still at a severe risk. Next slide. Another report and study we looked at was called the COVID-19 Mortality Risk in Down Syndrome, results from a cohort study of 8 million adults. This study shows that people with Down syndrome are 10 times more likely to die from COVID-19 than the rest of the population. So on the previous slide, we heard that people with intellectual and developmental disabilities are 3 times more likely to die. And this says specifically regarding Down syndrome that people are 10 times more likely to die from COVID-19 if they contract the virus. On top of that, we looked at a tracker from the Atlantic that was previously mentioned earlier in Dessa's speaking. And this long-term care COVID tracker looks at long-term care facilities across the country. And as Dessa mentioned, it said that less than 1% of America's population lives in long-term care facilities. But as of February 4th, 2021, which is just 6 days ago, this tiny fraction of the country accounts for 36% of United States COVID-19 deaths. People with disabilities who live in such settings are at the highest risk. This is important because we hear a lot from our state and county and city leaders that folks in congregate care settings are getting vaccinated right now. But in our research, what Dessa and I and others found is that there are a variety of different kinds of congregate care settings. Some people live in long-term care settings. Other people live in group homes. Some of these settings are big, some are small, some are licensed, some are independent. So right now, we are trying to make sure that no matter where you live, that your congregate care setting or your congregate setting is covered and you will get vaccinated. But it's been a challenge. To highlight this challenge, first and foremost, progress is being made some places. Here, I list a snapshot of states prioritizing people with disabilities. For example, Maryland is vaccinating people with intellectual and developmental disabilities and folks in congregate care settings. That's great. Ohio is vaccinating people with congenital, developmental, and early onset and initiated medical conditions to include several disabilities. That's great. New Mexico is vaccinating people age 16 and over with intellectual and developmental disabilities. That's fantastic. New York has now listed several disabilities that are prioritized for vaccine delivery to begin in 5 days. And California recently, on Monday, committed to plans prioritizing people with disabilities by the end of this week. So by Friday, California will have its act together and more people, including people with disabilities, will get vaccinated. That brings us to Michigan. This is a slide that is being shared in many circles with regard to who is prioritized. And so this is what's called the interim vaccination schedule. And I know the writing is a little small, so I'm going to verbalize it for everyone. What you're looking at is a grid that has phases 1A, 1B, 1C, and 2. It has people covered. It then has a calendar of when ideally using this interim vaccination schedule, people might get vaccinated. And that's why you have some green shading that fills in the different months. So we are currently in February. Looking at this chart, it says that right now, healthcare workers are getting vaccinated. Long-term care residents are getting vaccinated. People that are 75 years and over, not covered in phase 1, they're getting vaccinated. Frontline responders at the county level, the state level, and the federal level, they're getting vaccinated. We're also vaccinating school and childcare staff, corrections staff, so folks that work in prisons and jails, and other essential frontline workers. That's all being vaccinated right now. And then you have some green a little bit farther down in area 1C that says folks that are 65 to 74-year-olds, they're getting vaccinated too. What it doesn't say on this list is people with disabilities. There is a people covered section in 1C that says 18 to 64-year-olds with COVID-19 risk factors / pre-existing conditions. It does say that they will start to get vaccinated in May. And then it goes on to say all remaining essential workers will get vaccinated in May and June and beyond and after. And folks that are 16 to 64 years not covered above, they'll be vaccinated toward August, September, and toward the end of the year. That's what we'll call maybe the general public. But to not confuse anyone, I did specifically say that we don't see the word disability on this chart. We don't see the words intellectual and developmental disability. But if you do some digging into, we'll call the bucket of 18 to 64-year-olds with COVID-19 risk factors and pre-existing conditions, the folks that may start getting vaccinated in May, you'll see that that does contain folks with Down syndrome and some other conditions. But it does not list, again, intellectual or developmental disabilities. So that brings us to why we're here tonight. Everyone, I assume, that's joined us today, and I know for certain our Detroit Disability Power staff wants to make changes to this interim vaccination schedule. And that's why we are making moves and asking people to respond to a call to action. We believe deeply that people with disabilities should have immediate access to vaccinations to assist with the COVID-19 crisis. And we really need your support in reaching our leaders, the mayor, our county executives, the governor, the staff of the public health departments. And so what this information graphic or infographic that we're looking at now says is everything I just went over, bite size. And it says, listen, last March, the World Health Organization flagged concern that COVID-19 would negatively affect the disability community. What do we now know about COVID-19 deaths in the United States? And everything we just mentioned, we know how it's affecting intellectual and developmental disabilities. We know how it's affecting people with Down syndrome. We know how many people it's hurting and killing in long-term care facilities. We know that we live in a majority Black city in Detroit, and that within that, we have 126,000 people with disabilities, but the majority of those folks are women and Black. And we know that other states are getting it done. And I accidentally put something over here, but this says Maryland right here, and there's a picture of Maryland. So what this ultimately says below that, all the writing, is that, listen, Maryland's getting it done, Ohio's getting it done, New Mexico is getting it done, New York is getting it done. A few other states that aren't listed here are getting it done. So please, 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 let's call to prioritize people with disabilities in this vaccination rollout. And at the bottom of our infographic, we say, call Governor Whitmer here, call Mayor Duggan there. And in addition to this, we have opportunities to sign on a letter that goes to the governor and the mayor and our healthcare officials that says, listen, we really need to make some changes. We're not gonna wait to change things next month or in the summer or next winter. We want the changes made now. So that's the bulk of my presentation. There's so much to cover and it is complicated, but that's why we wanted to hold a teach-in today because we really, really wanna make sure everyone has this information so we can have the best discussions and really ultimately empower everyone and give everyone agency to make this a better process. Thank you.
Thank you. This is Dessa. Jeffrey, thank you so much for sharing that very important information. We have a little bit of time for some questions and answers here. So I see Marguerite's hand is up. I just want to, as a little bit of housekeeping, ask everyone to please say their name before they speak so that our interpreter and our captions know who you are. And also, well, there was a second thing, but I forgot what it was. Oh, you can also chime in via chat if you don't want to unmute. So we'll start with you, Marguerite. What is on your mind?
Thank you. This is Marguerite and Scarlett. Scarlett is my sister. So I've been keeping up with everything with COVID. And in the last week and a half, Henry Ford Hospital been contacted me because I am 65. I am a woman and I am American Indian and African American Indian descent. So, and I am a person with CP speech and hearing loss. So that put me up to the higher level. And I am I don't have any major health issues, but I am very skeptical about getting the vaccination. But I prefer doing it in the hospital setting because I don't know how my body will react to, to the vaccination. So, so many people, and I also live in a high-rise apartment who some tenants do not like social distance. Um, so whenever I go out, I'm always trying to keep at least 7 feet away. Because with the extra feet for that my superstar can have no room. And there are people who may not get it right away. And they are the ones I have to look after.
Hey, Marguerite, thank you for sharing all of that. And
I'm done.
yeah, this is Dessa. I appreciate you kind of sharing all the nuance that has to be considered when coming up with a plan for a very diverse community. And, I think as Jeffrey has been working so hard on trying to promote policies that work for our diverse community, sometimes that diversity makes it challenging. But here's the deal. We don't quit because it's hard, right? That just means we have to do it even more. And so I really do believe the diversity of our community is really brilliant. And really offers us an opportunity to come up with holistic solutions. Jeffrey, did you want to jump in and then we'll go over to you, Tammy?
Yes, please. Sorry, Tammy, I just want to respond to Marguerite's question. So I put in the chat for everyone's information, the city of Detroit on yesterday or on Monday, the city of Detroit said that if anyone is 65 or over the age of 65, you are eligible for a vaccination. You can call 313-240-0505 and you can schedule a vaccination appointment for next week. If you don't have a car, if you don't have access to a personal vehicle, one will be provided. And there are also opportunities to access wheelchair accessible vehicles upon request. However, none of this addresses Marguerite's concern, which is about having access to medical staff and facilities based upon an adverse reaction or something that might happen if getting a vaccination produces a negative experience. And so Marguerite, what we will do is take your concern to the city. In fact, I think someone might be on this Zoom from the city. And I think that what we can do is just make sure that for folks that do go to the TCF Center, that they make sure they have adequate medical assistance. And we'll also ask if there's ways that people with disabilities in the city of Detroit can continue to access vaccination in local hospital settings. I know there's conversation right now about having it in some hospital settings, having it in county health centers, having it at CVS, right? So we want to make sure no matter where people get these shots, that your concern is addressed. Thank you. And Tammy.
Thank you.
Hi, I'm new to the group and I'm glad to be here. I receive emails from you guys all the time. I think I've even donated to some of the
Yay.
causes. Yes, and
Thank you.
yes, and I'm a mom of children with disabilities, and I am the inventor and the creator of the Community Treehouse Center that is for youth and adults with disabilities for programming. So that'll be in the Jefferson Chalmers community. It's called the Manistee Community Treehouse Center, and we'll start building this year. So when you guys sent me this email, I actually got to talk to our deputy mayor, Mr. Mallard, Conway Mallard, about the issue that you guys were having. And this is what he said to me. I had him text it to me so I wouldn't get any words mixed up. He says that they're working on a policy directly related to disability outreach, which will be announced either Thursday or Friday. The mayor is aware that we need to outreach further into the community, and we're working on that right now. So I wanted to bring that information to you guys. What I got from the deputy mayor, they're gonna be, so if you have any more issues and I can get in touch with them, email me if you can't reach them. So that's what I got from him. So I was bringing that to the group today. How you doing? I was bringing it to the group today to let you know that some help is on the way. And I'm proud to be here and be among you guys who are really doing this great work. I
Oh,
I really want to be a part of this, and I want to be a part. Want you guys to be a part of what I'm doing over here in Jefferson Chalmers. So that's it, you guys. I'm just glad to be here.
Tammy, thank you. This is Dessa. As a fellow East Side Detroit person, I can't wait to come see that treehouse.
Yeah.
And we are so grateful for your advocacy and organizing. I love that you called the person you had a phone number for and got through like that. If we can keep doing that, we are definitely going to get what we need. I think Rami put in the chat a petition that we've been doing, and now we're asking people to make phone calls. And we've already had more than 350 people take action on that petition. And we just want to keep it moving until we get the policy in hand. Like, we will stop when we see the policy if it's good enough. If it's not, we will keep pushing. Jeffrey, did you want to jump in?
I want to acknowledge someone, and I wanted to make sure that this was okay. I believe that Christopher wrote actually also something into the chat, and I wanted Christopher to have an opportunity to introduce himself. If you feel comfortable, Christopher, please, by all means, feel free to pop on if you'd like.
Hi everyone, I'm Christopher Seth. I'm the new director of the Office of Disability Affairs, which will be announced tomorrow at the mayor conference at 1 o'clock. So if you could stay tuned to that conference, they will also announce, Mayor Duggan will announce his plan for the rollout. So I'm just here to see how you guys are doing, and I look forward to working with you. I just started, this is my 3rd week, and I'm just learning everything about the city, and I'm happy to be back. I grew up here in Michigan. I'm a Michigan native, and I just came back this year, so I can be helping out. I'm sorry, it's just been a long day. So I just want to drop a note and say hi, and I'm excited to work with you all.
Thank you. This is Dessa. We're really excited to have that position and have you in it. For anyone who isn't aware, the Office of Disability Affairs is new and only exists because disability activists in Detroit made it happen. And so this is a huge win. And Christopher alone can't do it. So we need to get the mayor to put some more money in that budget and hire some more staff. So stay tuned. The work is not done. We only have about 7 minutes left together, and I want to hand it over to Rami to catch us up on the chat.
Hey folks, this is Rami. There are a couple questions lingering. Susan asked earlier about Detroit doing drive-through vaccinations. So if anyone can speak to whether that's the only option. And then she also asked if MPAS is involved, MPAS. I don't know, I'm pretty sure you mean Michigan Protection and Advocacy Service. And so that's one. And then Maggie is also wondering if what Tammy was talking about is for all of Detroit or just Wayne County. But we can have Tammy either chat that answer or come on right now.
All of Detroit, not just Wayne County. All of Detroit metro area. We're not turning anyone away.
Fantastic. This is Dessa. So to answer, hi Susan, I'm really glad you're here. To answer your question, there are drive-through, I'm trying to find your question so I can actually do a good job of answering. Drive-through vaccinations. Jeffrey, can you speak to this? I know that there are drive-through test sites here, and I know that there are mobile testing units here, and that we're hopefully going to be having some mobile vaccination units too now. Do you know more, Jeffrey?
This is Jeffrey. What I know at this time is that the main focal point for vaccinations in the city of Detroit is the TCF Center, formerly Cobo Hall. And I have not got a vaccine there, but I do know people that have, that did drive up and drive through, and were in a line of cars for quite some time, and were given shots through the car. And so I do know that the mayor's office or the mayor announced that some local churches will be starting to provide vaccination. And that will be a new practice coming online this weekend, I believe, and continuing in further weekends. And I think that, again, as I mentioned earlier, you will see some movements because the mayor said the city's trying to ramp up to about 25,000 vaccinations a day. And so that'll have to come from a variety of places. So it's also really important that we as advocates and activists and community voices make sure that no matter where these places are that provide vaccinations, that they have everything they need there to meet our demands, concerns, needs, etc. So we want to make sure there is American Sign Language interpretation. We want to make sure that there is multilingual interpretation. We want to make sure that everywhere is informationally accessible, geographically accessible, physically accessible, and so on. So we'll monitor. We ask that you do the same, and we'll be working with Christopher, just like everyone else here, to make sure when he learns something that we all learn it together.
This is Rami. We have another question in the chat, but it was sent privately accidentally, I think. This is from Annette. Sorry if I mispronounced your name. In East Lansing, we don't have any of these aids. How do we get help here to advocate for us?
Thank you. This is Dessa. So, Onette, the little bit that I do know about you makes me think that you might have already been doing the thing I'm about to suggest, which is calling your city council, calling the local health department director, and getting every disabled person you know to do the same and every ally to do the same. But I also know that's a little unsatisfactory because if you've been trying that and it's not working, you're probably as frustrated as the rest of us. I do, and anyone else can jump in here with ideas. What I will say is that some of the kind of bigger advocacy organizations for people with disabilities are located in the Lansing area and might be good resources as well. The one that was referenced a minute ago, MPAS, actually has a new name. They're called Disability Rights Michigan now. Some of those folks live in your area. And actually, I got an email from them the other day about how do we turn the mobile testing units into mobile vaccine units that not only drive through neighborhoods, but go into people's homes who are homebound for either health reasons or because their houses are inaccessible and they can't get in and out. And I know, as sad as that is to think about, there are many, many people in that situation who can't get a vaccine literally because they can't leave their house. So yeah, and I'd love to hear other ideas. Jeffrey, what's on your mind?
I wanted to note, Amy had put in the chat to make sure that you contact your local state representatives and senators. All kinds of elected officials need to be talking about disability consciousness and disability voices, especially in a time when we are living through this pandemic, the recession. We saw a great deal, and we continue to see situations regarding racism and ableism. And climate change is affecting each and every one of us. So we're living through a multi-crisis right now. Disability voices must be at the table, must be prominent on every screen, at every table. And I think the last thing I wanted to note was Rami mentioned something in the chat I was supposed to say earlier, and I wanted to bring up again, which is we are having a call to action, and I mentioned it, but what I didn't say is we have a specific script that you can use and also can be adapted for your local politicians. And so Rami put that in the chat. You can scroll up to it. We can probably post it again. Oh, there it is. And it basically says, you know, this is who I am. I'm a resident of this city, of this state. I am calling to demand that people with disabilities become an immediate and higher priority in Detroit, in Lansing, in Michigan's COVID-19's vaccination rollout. We talk again about the World Health Organization and their concern last year. We talk about the terrible developments in data that have occurred, you know, and we're highlighting them, underscoring them, the severity of it, that this is unacceptable. We're showing that if these other states can look at the CDC guidance and find a way to serve people with disabilities, Michigan, you got to do that too. And then we ultimately end by saying, where are you leaders? Come on through, work with us. Let's change Michigan for the better. We'd really appreciate it. People with disabilities deserve vaccinations now.
Thank you.
And one last thing, sorry, just
Mhm.
I want to make sure I say this. Onit, if you write a letter, I will sign it and back you up. And I have a feeling everyone on this Zoom call will back you up. So I want to make sure if you write that next letter and you have your voice, well, maybe you'll have 20 other voices right there behind you, next to you, as you move forward and as we move forward for something better. Everyone should walk away from this experience knowing that they are not alone. We have room for improvement across the state, across the country, and we're in it for the long haul. So thank you for joining in.
This is Dessa. Thank you. Oh, Annette, were you about to unmute?
Yes. Hi, guys. This is Annette. Thank you very much for hosting this quorum. Again, I'm in the East Lansing area, and if there's any assistance in this area, it's very well hidden. And I am so very determined to change that. Not just for myself and my family, but I'm also a minister, and that's my ministry, is community outreach. And so far, I have seen very little outreach for the disabled people. So that's why I'm here. Thank you very much.
Yeah, thank you so much for bringing that up. And I have your email address. I'm going to connect you to some folks I know in Lansing area directly, just some really great disability activists that hopefully will be able to be helpful. I guess, you know, the thing I'll say, and we're going to close in just a moment, is what I started out saying, which is that as disabled people, we fall through the cracks on a good day normally, right? Like this society wasn't really set up for us to get our needs met or for us to succeed. And while that's really sobering and depressing, the really good news about that is it does not have to be this way, right? Nothing about that is inevitable. It's about people in power making choices. And so A, we need some different people in power, and B, the people in power need to listen to us. And so I really believe that we actually, it's not going to happen overnight. And we didn't start this movement, right? We are on the shoulders of many, many people. But I really do believe that we got to keep hammering, and it will start to change. They will stop ignoring us. And they're starting to stop ignoring us, if that makes sense. So, you know, we got juice for this. You know, we're going to keep doing this, and we want to do it with all of you. So we don't care if you're not in Detroit, like we want to do it with you too. So I'm loving the hearts. I'm also aware that it's 7:04. Thank you so much for coming this evening. And Marguerite, do you have a real quick thought before we wrap?
Yes. What about putting this on social media platform?
This is Dessa. That's a fantastic idea. We did record it, so we can share it. So all of you will get a follow-up email from us in the next day or so. But we'll also make sure to post all of this to the Detroit Disability Power social media. What a great suggestion. Thank you. All right.
Thank you.
Yep, absolutely. With that, I think we'll wrap. Appreciate you all. Have a wonderful night and be safe.
Thanks for coming.
Love and hope.
Rami, we have the same shirt on almost.
Yeah.
Good night, everyone.
Good night. Thank you. Thank
Good
you.
night.
Good night. Good night.
Thank y'all. Take care. Good night.